time before the beginning of this to say, good day, friends of Buzzy. So we are having a big coronavirus spike everywhere in the country, and I was asked, what is my family doing and why are we doing it? So today I'm going to go over everything I know about coronavirus. I'm Dr. Amy Baxter. I'm a pediatric emergency doctor, and my primary reason that I am up on coronavirus is I was asked to be on an emergency department guideline task force for the CDC. Plus, I've just been following this along because it has seemed since January, February, that this is going to be a big deal. So I appreciate everybody who's written in. I appreciate all of your questions. I will try to answer all of them. And I particularly am thankful for Laura's family in Canada for their support and for the people who told me that I need to get a microphone. So I have a microphone. I don't have a dongle to attach it. Next time, good sound. But today, I'm going to answer all of your questions as loudly as I can about what my family does and why. And it really all hinges on three factors. What we know about the transmission and spread of coronavirus, what we know about the severity and who gets severe disease, and then what we know right now about treatment and treatment possibilities. So, spread. At this point, we're pretty convinced in the scientific community that spread is largely respiratory. To be more precise, it's not just the big respiratory droplets that are stopped from sneezing and coughing when you're wearing a mask. It's also aerosols. So aerosols make a difference for a couple reasons. For one thing, when it is warm and when the humidity is relatively high, these aerosol droplets can stay circulating around for quite some time in air. Quite some time can be defined as a matter of hours. So because of the respiratory spread, inside is much more risky than outside. Inside, you're going to have fewer air currents. Depending on how often your air condition circulates and cleanses the air, you're going to have more concentration of respiratory particles. Right now, the best guess is that anything fewer than 1,000 viral particles is unlikely to spread disease. More than that is. So looking at that and being able to gauge how many viral particles are in the air that you breathe in by time, one scientist came up with an estimation that if you were in an indoor place for 15 minutes, less than 6 feet apart with no masks, that is long enough to be infected by somebody who has coronavirus. So what my family does is we have a number of different masks that we keep in a pile. These are the ones that I made myself. I'm actually still okay with these. I mean, the biggest thing about masks is that while they do protect you, they protect others, not just from coughing or sneezing, but it turns out the biggest way that viral particles are exhaled is singing, followed by talking, followed by hard exercise, followed by just sitting. So there haven't been any super spreader events in a movie theater, for example. If my kid wanted to go to a movie theater and they were wearing a mask that fit well across their face and they stayed in the whole time, I'd be okay with that. But otherwise, last night my daughter wanted to go to a party that was indoors with friends who probably weren't going to be wearing masks, and both of us decided not a good idea. Now, had that party been on a rooftop, I'd have been okay with it. So our family is having other couples over on the porch with a ceiling fan circulating outside without masks. But if we were to go inside, or if someone wanted to use our bathroom, we would ask them to wear a mask. It doesn't seem like surfaces are that big a deal. Even though coronavirus can stay alive, it's not infectious. And so the amount of people who are getting coronavirus from touching surfaces and then touching their face or hands, probably not. Most of coronavirus spread is coming from respiratory, upper respiratory. Now this is interesting because that means it's not just the inside of the nose. So putting Vaseline or doing something to protect the inside of the nose like a spray may help, but it's probably not going to do it. Most of the spread And the initial colonization, the initial place where the virus is hanging out, is in the upper passages of the nares. So that's deep inside the nasal passages, which means that for our family, if, say, my son, who is quarantining with his friends from college in their apartment, if he comes over, I will hug him with both of us wearing a mask. And after he leaves, I will nasally irrigate, usually with betadine. Betadine definitely kills coronavirus, but a half a teaspoon of betadine in an irrigation may or may not be the big thing. I think the big thing is going to turn out to be that we're flushing these away because the spike of the coronavirus is fairly loosely attached to ciliated epithelia. So flushing it out so that you don't get as many viral particles spreading inside you is probably something to decrease severity that's going to matter more than killing the ones that are attached. So that's what we do. My daughter did her first nasal irrigation after a shift at work the other day. I was very proud. I promised her I would not put the video on for other people to see. But even a teenager can get used to doing nasal irrigation. Now, the severity is related to how many viral particles you get. This is why we're seeing more severe disease with people who are living in the same household in a small environment that are being exposed to high levels of virus over time, because severity is proportional to how attacked you get. One of the reasons for this could be that the ACE2 receptors that upregulate the bringing in of the virus, those actually get triggered in the lungs from the upper airway. So if in the back of your nose you've got a lot of viral particles that are starting to move their way in, and it's really creepy actually. It's not just that like normal viruses, they go into the cell. They go into the cell and then instead of just making more virus, they do something called filopodia. They basically get these spikes, very matrix, and they go jam onto the adjacent cells. So they're not just going in one cell, manufacturing more virus and then exploding it out. They're going in the cell and they're putting some energy into going sideways so that they can spread a little at a time by slicing through the adjacent cells and spreading that way. Super creepy, but also takes a lot of resources, which means that it is very slow spread. So once a virus has invaded a cell, one of the things that it does is it upregulates the ACE2 receptors other places in the body. Now this upregulation makes you more likely to get more severely ill. So what are we doing about that? Well, one thing that is new and interesting is that it seems like one of the cytokines that's causing this invasion and this upregulation is CCR5, and there's also CCR1. And these are interesting because they're also related to HIV uptake in cells. One thing that does a good job of blocking that is zinc. So our family, when we think about it, not religiously, we're taking zinc with meals. Another thing that blocks the uptake of this is ivermectin. Ivermectin is a dog parasitic, antiparasitic. It has been shown to kill the uptake of SARS-CoV-2 intensely in vitro, meaning in a little petri dish. In vivo, it does a good job on a lot of different viruses. It's an antiviral as well as an antiparasitic. The studies are ongoing right now. In fact, one study in France just got a green light to continue on ivermectin. I do not have any ivermectin at home. If I were to get ill, I would want to get probably 2 doses twice a day for 2 days of ivermectin at about 200 micrograms per kilo. I would ask my doctor to write for this for me. I have not yet. I don't think it's worth hoarding anything. The other thing about severity is that we definitely know that your immune system is related, and it's also going to be related to blood type because that's one of the issues with coronavirus. Young people are saying, it's not a big deal, I'll catch it, I'll go on. The problem is that a fairly high percentage of people who catch coronavirus, so 80% may have mild symptoms or be asymptomatic, but in that other 20%, even with young people, you're getting clots, you're getting strokes, you're getting altered mental status, you're getting depression, you're getting prolonged fatigue. I'm hearing about people who are sick and have been tired for months. So if we were to get coronavirus, I would certainly make sure everybody in my family knew about proning, which is to lay face down so that your lungs can work better. We also do have a pulse oximeter at home. One of the signs of severity of coronavirus, that it's not going to be a mild asymptomatic issue, but it's actually increasing. The sign of severity of coronavirus is that you can't do 1 minute of exercise without your oxygen dropping. I'll put a link to a place to get an oximeter that's inexpensive, but it only hooks up to iPhone like 5, 6, 7, 8. You've got to have an adapter, just like I have to have an adapter for this phone to use a microphone. But they work fine, and so having a pulse oximeter around the house so that if you're worried, you can try walking in place to see if your pulse ox drops by 3% or more. That is when I would worry enough to go to the emergency department. If your oxygen's fine, even if you have it, then they're not going to do anything for you at the emergency department that you can't do at home. And to be honest, the state of the art with ivermectin is not high enough that people would use it. People are asking about steroids and Decadron and immunomodulators. Here's the thing about the immune system and coronavirus. When your immune system goes overboard, that's when the lungs end up getting infiltrated. That's when you start having your heart, liver, kidneys, other organs be attacked. So it's really tricky with the immune system drugs. When you're first getting sick and it enters the upper respiratory passages, that's when you want your immune system to be top-notch. You don't want to be taking any steroids, any prednisone, any methotrexate, any Decadron, anything like that, because it will put out the fire just as your immune system is trying to catch it so that it can fight. When people are getting sick and they're not yet intubated, one of the ways to mitigate this is to block some of those cytokines. So there are drugs that are IL-6 blockers, anti-tumor necrosis factor blockers. Those are almost a fire break, and we will probably be using those. And if I were quarterbacking one of my family's disease patterns, I would try hard to get a dose or two of an IL-6 or an anti-TNF blocker if they're in the hospital. The Decadron is, once the fire is out of control, once the immune system has gone crazy, Decadron is the helicopter that brings in the water to splash all over the wildfire to try to put it out. So don't be fooled, and don't let anybody in your family take a dose of any kind of Decadron, prednisone, any medicines you might have sitting around from an asthma outbreak or from somebody who's got rheumatoid arthritis. Those are going to be very harmful early on in the course of disease. Let me see. So a couple things about what we're going to do for the winter and the fall. I am fine-ish. I'm fine letting my children go to college. I will warn them against being in parties indoors where people are not wearing masks. It's a short period of time. I know that's not what college is like, but when humans are in the middle of something terrible, we tend to think that it's always going to be like this. I saw a doctor who said wearing masks makes it so you can't see each other and turns us into a zombie state. You know, people in Southeast Asia have been wearing masks when they're sick for a long time. They don't look like zombies. Just wearing a mask doesn't make you into a zombie. And the important thing is, this is not forever. 9/11 happened and we thought we're never going to fly again. We flew again. Now, Hindenburg exploded and we don't ride dirigibles anymore. So there have been some disasters that have had a lasting impact. But this is something that is going to take us another 6 to 9 months to figure out a cocktail of medicines, when in the course of the medicines we're going to give them, and within that time period, yeah, it may be a bit more boring than normal. So I'm going to let my kids go to college, but I'm going to recommend that They only go to parties that are on rooftops or outside. When it gets cold, we will start to see outdoor spread come back, because outdoor spread is very relevant to the humidity and the temperature. So once it gets lower than about 56 degrees, I'm going to revise this. The outdoor spread is not going to be 19 times less likely. I'm going to be recommending they wear their masks outdoors too. Masks are enormously important in decreasing spread. So if they're in college, I will absolutely require that they, to the extent that a mother can, that they wear a mask inside their classrooms. And for our kids, it's not going to be an issue. We know that we have a community, that we are part of a group. This is a short-time thing. This is a family of humans. And so wearing a mask protects yourself from breathing it in through your nose, and it protects your professor who you care about, your professor who you want to learn from. So I think that it is part of the responsibility as a human to protect each other in this, and that means wearing a mask in a classroom with your professors. The other thing is that whenever possible, I hope that their professors will have classes outside. There's really no such thing as bad weather, it's just bad clothing. So I'm buying them extra rain gear, extra gear so that they can hang out outside and be warm and not have to go inside and worry about it. Final thing to think about is what can all of us do, particularly in the situations we have now where it is a political issue whether you wear a mask or not. There are multiple studies showing that mask wearing is one of the most effective ways that we can decrease spread in our community. But I think we're all seeing videos online of people who are standing in the middle of Trader Joe's being Karens, saying that they don't want to wear their mask because they have a right not to. In this situation, one of the things about community that would help is, especially if you are white, use your privilege to help the people behind the counter who don't have the power to ask. If somebody is refusing to wear a mask, go ahead and say, hey, we're all part of this community. Can you be kind and wear your mask to protect yourself and others, and also so that that poor kid who's working behind the counter doesn't have to ask you, because it's their job to ask you, and it's hard for them to do that over and over again. It's not fair. So do you mind just putting on a mask? With that said, I think we're going to come out of this just fine. This isn't the Hindenburg. This is a situation that will last maybe another 6 to 9 months before we get our hang of it. So I do think now that what our family is doing is we're buying puzzles, we're buying shelf-stable milk, we're buying all the things that we're going to need again so that we can stay in our homes or in their dorm rooms or in their apartments come October, November. So prepare for it now. Get your family prepared, your little kids if you have them. Figure out plans for the fall now, because this is still going to be an issue then. But come next spring, next summer, we're going to have most of this figured out, and it's going to be fine.